Hello, so this is my self-reflection, readiness for practice um, assignment for internship number 2. I'm going to be doing a video instead because I always do written assignments and honestly I'm kind of tired of it and I always write too much. So I feel like this will be a little bit shorter and more concise, which will be better for you to mark. So I do have a computer in front of me just to look at the questions, and then I'm going to answer them to the best of my ability. So for our little brief overview, for my clinical placement section for this half of the semester, I'm working with the chronic condition section. So prior learning experience before coming into this course. So as far as chronic conditions go, we have had some slight exposure in special populations courses throughout the 3 years we've been at the school. And also the pathophysiology courses and physiology courses, of course, helped us with some chronic conditions as well and helped dissect those chronic conditions well. Of course, we have off-campus and on-campus exposure to various kinds of clients with various kinds of conditions. However, with my personal experience and the clients I have gotten throughout the years I have been at school, a lot of them have been young students, specifically young students that don't really have anything wrong with them physiologically. It's more musculoskeletal problems like back pain, joint pain, things like that. And it's primarily because chronic conditions, they can happen in the younger population, of course, but a lot of them also happen with the older population. I haven't been exposed to a lot of middle-aged to older adults. I've been exposed a lot to basically 40 and younger. So that kind of has a slight exposure there, but not really because I haven't worked as much with chronic conditions as I would like. That kind of goes along with clinical experience. That would be my clinical experience would be basically the off and on campus internships that I have had slight exposure to. I've had a couple of hypertensive cases, and I've had a type 2 diabetes case, but that's basically it for the chronic conditions. I haven't really dealt with any kind of chronic edema, any kind of cancerous issues, anything like that I haven't dealt with. So that's kind of something I'm hoping to gain from this course. Personal experience. So yeah, I've had a couple of family members with chronic conditions. Specifically, my dad has type 2 diabetes. He has had it for a couple of years now. And I treat him regularly for practice for myself, of course, for my upcoming OSCEs and exams, and also for practical examinations at the college. So I do practice on him often. So that would be kind of the most exposure I have had personally for chronic conditions, specifically when it comes to treating a person with chronic conditions. But yeah, I haven't really been exposed to a lot of chronic conditions that are past that. So I haven't really been exposed to type 1 patients. I haven't been exposed to chronic liver disease, chronic heart failure, chronic edema, anything like that I haven't really dealt with. I haven't even dealt with fibromyalgia, so definitely that I would like to be exposed to eventually during either school or in my future career. First week of clinical placement, explain how that was. Basically, first week of clinical placements, we got together in a group and we had some orientation what the course will be about. We will be dissecting chronic conditions week by week, and we'll also be working, we will get a patient from our instructor, and we will dissect the chronic conditions and how we will assess and treat the patient according to their condition. Emotions, attitudes, values, assumptions, and beliefs about this topic or about this course. So I'm really excited to learn about more chronic conditions, especially because I haven't had a lot of exposure to it. I have had a lot of exposure to the younger, healthier population and not really with chronic conditions or people with presenting chronic conditions. Of course, this would be beneficial for me to learn because then I know how to modify a treatment accordingly and safely for the patient. Confidence. Explain your confidence, how you feel about treating the chronic condition population. So when we're learning over a computer virtually, of course with COVID we're doing clinical placement online, or if we're doing special populations, or even if our instructor is just simply explaining it to us, we always seem confident. Yeah, I get it. Okay, I understand what to do. But when it comes to real life, I feel like we're not as confident because we always freeze when we see something different on the health history. So if we're used to a certain population, young athletes, and then all of a sudden we get a 65-year-old with type 1 diabetes that's overweight, we kind of freak out because we're not really used to that exposure. We're not used to that clientele. So that's kind of when the confidence drops, and a lot of people, especially me, gets very nervous, and we kind of, freak out. So again, that's kind of why I am hoping this course will help with my clinical and personal experience, and also with my learning experience as well, because then I can try to apply it to chronic conditions that I'm working at home. For example, I can apply it to my dad, or either other family members once COVID's done that have chronic conditions. I can apply it to them and kind of practice that before I actually get hired as an RMT at a specific clinic, or if I work for myself at home. Strengths and weaknesses. So some of my strengths, I'm pretty good at logically thinking through scenarios. So if I'm not exposed to something and something's on the health history, like, oh, the patient feels dizzy, for example, I'd probably most likely limit the movements, maybe treat them in semi-recline. And if they're really dizzy, probably do even an assessment seated or partially standing, stabilized by the wall or something like that. So I'm pretty good at kind of nitpicking things and adapting it to the scenario. Of course, some of my weaknesses, I've had worked a lot on this weakness, but I really get nervous if I really don't know what to do. I kind of freeze. I can't think straight. I get extremely nervous. I get a little bit panicky. And then because of this, I may forget some steps. So the benefit of me being a student now is that being a student, that's the time to kind of mess up. If you mess up during clinic, it's not fine, but it's better to mess up in clinic when you have a professional working with you, rather than you are the professional and you don't know what to do. So that's kind of the benefit of being nervous kind of during school, because that kind of prepares you to actually do it in real life. But again, I do have to kind of work on this because I'm not always going to have an instructor right by my side. There's a lot of students in the clinic, about 8 to 10, and they're not always going to be with me. They're going to be circulating with other people. So I also have to really take into account my learning experience, clinical experience, and personal experience, and apply it to the client, and trust that I'm doing it confidently. And that will kind of help amplify the strength that I have, which is basically logically thinking through scenarios. Yeah, so that's basically my reflection for readiness for practice for internship number 2. Thank you.